simultaneous antibiotics and fluid. This is old. This is 2000. This is us now. This is good. By the way, that was not this. I'm sorry, bear with me. There's one slide. I'm sorry.
Septic shock is a very serious condition.
This is it.
About half the patients who
7 minutes.
septic shock
Really
die
watch this,
within the
guys.
first month of their diagnosis. But what is septic shock? Well, let's break down the two words.
Too loud?
Septic comes from the old Latin term meaning rotten. And the word shock, of course, means decreased tissue oxygenation and low blood pressure. So combined, it's decreased tissue oxygenation caused by something that is rotten. Now this rotten thing is an infection, infective material that causes some sort of inflammation. So it's infective material that causes decreased oxygenation of tissues. So how does infective material do that? Well, let's take a look at a blood vessel. And of course the blood is used to deliver oxygen to tissues. So here are some red blood cells, and I'll put some tissues right here. So these little boxes represent cells. And so these red blood cells are supposed to transfer oxygen, this little purple substance right here, to these cells. Delivery of oxygen to the tissues. Now let's say there's some sort of infective material in the bloodstream. White blood cells will encounter this infective material, whether it's a bacteria, virus, or a fungal infection that's in the bloodstream. So now your blood vessels are like pipes, septic pipes, containing this sewage, this unclean material. It's no longer sterile. So these white blood cells, their job is to find this and clean it up. And of course, when white blood cells encounter this infected material, they activate. When they activate, there are several things these white blood cells do. First, they're going to call on other white blood cells to come and check this out. Because the idea is you want to recruit as many white blood cells to wherever this infected material is so you can eradicate it. So first, white blood cells recruit their buddies. Now here comes a major point. This infected material is normally not in the bloodstream. In fact, it's usually out here in the interstitial tissue. So usually white blood cells have to get into the interstitial tissue and eliminate the threat. Now white blood cells do that by releasing molecules such as nitrous oxide. The molecules that are released interact with the blood vessels and cause the blood vessels to do a couple things. First of all, blood vessels will dilate, or in other words, the diameter of the blood vessel will increase in size. So let me go ahead and erase some of this so we can show the dilation of the blood vessel. So let's make this dotted, showing that it was this size, and now blood vessel diameter increases. So we've increased from this size to a little bit larger. This causes a localized decrease in vascular resistance, systemic vascular resistance. The blood, all of the blood contents, have more space to move around, and there's less resistance that they're bumping up against because of this widened diameter of the blood vessel. So there's increased diameter of the vascular space. Now, of course, this makes sense. If this is happening locally, blood slows down in an area where there is an infection. Because remember, the immune system usually encounters infected material in the peripheral tissues. To be able to get into the peripheral tissues, white blood cells need to make the blood vessels leaky. And so that's the second thing that's happening here.
Just real fast. So if someone has a skin infection and bacteria get in the skin through an invasion, what do you see? You see red, right? The skin gets red. Why is it red? Because of that. You have it localized, and this could be a pneumonia in the lung. This could be meningitis in the GI system. We'll just talk for skin, we can see it around the bladder, the cystitis. It gets red because you had localized vasodilation, capillary leak, the white blood cells which live into the blood vessel leave and fight off the infection. What are the signs of infection? Rhubarb, dull, redness, warm, blood is warm, tender, swelling. That's what's going on. When that seeps and goes to the rest of the body, systemically, and the rest of the blood vessels, you get sepsis. So,
increased diameter and increased permeability or leakiness of the blood vessels. Now here is actually the cause of shock. You have this infective material in the blood vessels all throughout the body. And so this happens everywhere. Systemic vascular dilation or vasodilation. And so this decrease in vascular resistance causes a drop in blood pressure. Because remember, vascular resistance and cardiac output equals blood pressure. So a large drop in this causes a large decrease in pressure. But also they have low tissue perfusion because the equation for tissue perfusion is really the same. Cardiac output and systemic vascular resistance contribute to tissue perfusion. But let me show you something else that's causing low oxygenation of the tissues, low tissue perfusion. You've got these cells that are receiving oxygen from red blood cells. Now with the increased leakiness, fluid will get into the tissues. So you have all this fluid buildup in the tissues, and this makes it really difficult for oxygen to get to the cells it needs to. It has to diffuse through all this fluid.
Now this could be the alveoli, the capillary blood flow around the alveoli. This could be the kidneys. Once this becomes systemic, you're going to have fluid in the interstitium. And the only way you can give oxygen to tissues is when it's connected to the hemoglobin. The gaseous form of oxygen doesn't do anything hardly to get to the tissue that it'll oxygenate. It's a minimal effect. So now it's not getting through because that capillary leak is filling up the interstitium with water, essentially, with the alveoli.
And so these cells become starved of oxygen. And so this is primarily what causes shock. Now there's a third thing that happens when these white blood cells encounter this infected material. They want to destroy it, right? If you've got bacteria or a virus or fungus, that's the job of the white blood cells, to destroy this infected material. These white blood cells release lytic enzymes and reactive oxygen species that cause damage to destroy this pathogen. But again, this is happening everywhere. So not only do you damage the pathogens, but you'll end up damaging the blood vessels as well. So that's number 3. You have damage of blood vessels. Now remember, this is happening everywhere. And because of that, serious complications can occur. First of all, when blood vessels get damaged, there are things called coagulation factors in the blood. And I'm going to make them this little lavender color. They're a protein that help cause clotting. So when blood vessels get ruptured, you want to create a clot to patch this up so that blood doesn't spill into the extravascular space outside of the blood vessel. Now again, this is happening to blood vessels everywhere in the body. I cannot emphasize that enough. So what ends up happening is these coagulation factors end up getting used up. They're trying to patch up all these blood vessels, so clots are forming everywhere. And some of these clots actually break off into the bloodstream. So an interesting thing happens. There's coagulation that's happening in the vascular system, but the coagulation can't keep up with the breakage of blood vessels. So sooner or later, blood is spilling out of the blood vessels. This weird state of coagulation in the blood vessels with simultaneous bleeding is called disseminated intravascular coagulation. Coagulation in the intravascular space inside the blood vessels, and it's everywhere. It's disseminated everywhere. So this is a very serious complication that can be seen in septic shock. And another complication that can be seen in septic shock is ARDS, acute respiratory distress syndrome. As you know, the lungs are highly vascularized. They have a lot of blood vessels because they need to be able to take oxygen from the atmosphere to saturate blood vessels. Now let's again return to our pathology of septic shock. This is happening everywhere, and the damaging enzymes and cytokines and different immune molecules end up damaging blood vessels in the lungs as well. And if you damage all of these blood vessels in the lungs, then oxygen won't be absorbed properly into the bloodstream. And so patients with severe septic shock end up in respiratory distress because they can no longer pull in oxygen from the environment into their bloodstream. So that's acute respiratory distress syndrome. Now, a final point that I want to touch on is the cardiac output. Cardiac output will initially increase to try to compensate for this decreased vascular resistance, right? It makes sense that if you increase cardiac output.
I'm going to be 5 more minutes and the show. I'm sorry, Raz. Speak. Here. Just want to make it skip a line. I'm going to just fly through some real fast. Now, I just want to talk about IV catheters. Does everyone get that? That was a nice little depiction, wasn't it? On sepsis shock. I think that was very, very beautiful, actually. Any questions on all that? No? We'll hold questions. Okay. So catheters, just IV catheters. So obviously, in seeing that, and me just rambling here, you can see that these patients, you obviously need the antibiotics to get rid of the microorganism, but you need IV fluid to counteract the shock. And we'll get into how much fluid to give, but you need fluid, and you need fluid to be fast. So let's talk about IV catheters real fast. There is a physical law where flow is related to the radius. So in other words, the bigger the radius, let's think about IV catheter, or filling up a NASCAR or a hose in the yard, the bigger the radius, the more flow you can get into the patient, or sprinkle flowers, or whatever you do with that. And then the length. So if you have a shorter catheter, you can get it in quicker. So it's actually not just a 1-to-1 ratio. It's the radius to the 4th, or the number, and 8 times the length. So it's exponential that it makes a difference. And you can see here another depiction, but at the time, I just want to get here. If you look at this slide I just put together, look at a 20-gauge catheter. Oh, I got a 20, cool. These are the best case scenarios. I'm going to do a bag, fill up IV bags, pull the catheter sometime in video at the show, drip fact. But with a 20 gauge, you can get about 60 cc's a minute. Then you go to an 18 gauge, 6.4 centimeter. So a long 18 gauge, you get 85 cc's an hour. A shorter one, go back to the form, you get 105. And a 16 gauge, 3 centimeters, you got 220 cc's an hour. So the size of the catheter and the length of it are huge, very important. There's a fallacy out there. Oh, let's resuscitate this patient. Shit, let's put in the triple lumen. But look at the triple lumen. The triple lumen is an 18 gauge that's excessively long. These are centimeters. I'm sorry, right here. Sorry. But look, it's 16 gauge, but it's 20 centimeters. So yeah, 16 gauge looks great, 220. But now you have 20 centimeters. Remember, it's 8 times length, 52 cc's a minute. You can't get fluid in fast with a triple lumen. You have multiple ports and you have a secured line, which is great. But an introducer is something you want to use, or a small fat IV. Does everyone understand that? That's Pasquale's law. Flow is related to the 4th power of the radius and 8 times the length. So doubling a catheter size increases flow rate by a factor of 16. Blah, blah, blah. I'm going to fly through some of these. You can see here, you can see a 14 gauge 2-inch needle. You can get over 200 cc's an hour. And you can see the different things here, different flows.